President Muhammadu Buhari has inaugurated a 62 billion naira HIV trust fund of Nigeria to help Nigeria end AIDS as a public health threat and place more people living with HIV on treatment annually. Inaugurating the trust fund in Abuja, the president pledged that his administration would continue to prioritize health interventions to address killer diseases and public health emergencies.
At the last United Nations General Assembly high-level meeting on HIV/AIDS, I made a call for a renewed global action to address the HIV/AIDS epidemic in Africa. Ending AIDS as a public health threat in Nigeria will require increased domestic funding. We have continued to make good our commitment of placing more people living with HIV on treatment annually using national resources. However, strong domestic resources mobilization with an enduring partnership and shared responsibility is required to sustain the response to HIV and other emerging public health emergencies. Going forward, I hope the HIV Trust Fund of Nigeria will galvanize more of the private sector and others partners to surpass the target of 62 billion naira in the next 5 years. I now officially launch the HIV Trust Fund of Nigeria.
About 80% of these funds were contributed by external donors, mainly the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the Global Fund to fight AIDS, tuberculosis, and malaria. The private sector contributed between 0.1% to 2% of total funds, with the rest of funds provided by the Nigerian government. Since 2005, about $6.2 billion has been spent on HIV response in Nigeria. About 80% of these funds were contributed by external donors, mainly the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and the Global Fund to fight AIDS, tuberculosis, and malaria.
As we launch this fund, I am reminded that we have about 2 million of our compatriots living with HIV/AIDS. And it is our collective responsibility to bring this number down to zero. We would like for the private sector to work in partnership with the federal government on a 50-50 basis, which we believe will help us eliminate mother-to-child transmission of HIV/AIDS in Nigeria.